Hey everybody, and welcome to Roadmap to Joy. I'm Megan Dean. I work for Embark. I have two teenagers of my own. I have a 16-year-old daughter who's a junior in high school and a 13-year-old son who's in middle school. And we're here today with Jake. He's joining us for a second time. We're really excited to have you on, Jake.
Yeah, excited to be here. I am Jake Sparks, the Embark Treatment Director. I am a licensed marriage and family therapist and been able to work with teens, adolescents, and their families for just a bit over a decade. So super excited to be here. I'm not in the teenager stage yet. I have a herd of small children, so not yet teens, but yeah, very excited to be here and talk about this very important topic.
Yeah, definitely. And September is Suicide Awareness Month, which is why we're here today. Unfortunately, this is an ever prevalent topic for many parents. For me personally, just to share with you all, growing up, I did have some close friends who were impacted by suicide and some family members as well. So this is definitely a personal topic for me and one that I'm really happy to, share more information about and help get more awareness around. So
Yeah, I think it's hard to find someone that's not touched by suicide in some way. Myself personally and professionally, again, have encountered it. And the ironic part of it is the science is so good. We know so much about how to treat depression, how to address suicide, and it's really a matter of getting the right information into the right people's hands, because there's so much that we can do to address um, to address the suicide across the country.
yeah, definitely. And yeah, I guess a good place to start would be this is just a really sensitive topic overall. It's tough to talk about for some people. So really, what's the best place to start?
Yeah, good question. So I always recommend we start with just some terms, because it is so uncomfortable that a lot of times I find when a family comes and sees me, they use a lot of terms that aren't really talking about it as a try to way to talk about it, because all of those really sensitive issues, we avoid it directly. So I want to just review a quick set of terms that we do use and then some that I will encourage us not to use. So whenever I have a client come see me and they're exhibiting some sort of what I would say self-injurious behavior, I'm always trying to tease apart, is this suicidal self-injurious behavior or non-suicidal self-injurious behavior? So we know there's a population of clients, typically adolescents or young adults, who might intentionally enact bodily harm as a form of emotional regulation. So this you hear about cutting or other types of self-directed violence, and we know that that's actually not a part of suicide. However, when you're a parent or you find out my daughter's been doing what, it's really hard to not jump to, does she want to be dead? That can be really difficult. So we want to really tease apart, is this suicidal self-injurious behavior or non-suicidal self-injurious behavior? And that's so important to start because that really helps identify the treatment trajectory. Now, both are problematic, obviously, but that really helps us to identify where we need to go and what the course of treatment will look like. There's nothing worse than being really misattuned. If I have a client that comes sees me and I just talk for hours about suicide and they're like, I'm not suicidal, can we give that up? And that can be a total mismatch. So we want to make sure we get that part right, if that makes sense.
Yeah, definitely. That definitely does. So, and then what's next as far as you mentioned talking to our clients and our kids is what do you say to them? How do you start that topic with them in that conversation?
So one of the questions a lot of parents have is, if I start bringing it up, am I gonna somehow put that idea in their head? Is talking about it dangerous? And where I think that's mostly coming from is parents particularly see their children as in such a fragile state. And sometimes they've even been operating on if I can just make it through the day, how to keep my child happy. They're smiling, they're on the couch, okay, they're talking to me, things good, don't rock the boat. So a lot of parents are just if we talk about what's really going on, that's going to be so stress inducing and I might create
Yeah,
some
I get that.
suicidal ideation. So the research is very clear that doesn't happen. If someone's thinking about suicide, they're thinking about it whether you're talking about it or not.
Mm.
Okay. So the most protective factor a parent can do, one of the most protective things, is they can have some really clear, honest conversations, and create an atmosphere where there's vulnerability and there's empathy and kind of set some norms in the family that we talk about what's really going on. And especially for a parent to say, there's nothing too big for me. There's nothing too scary for me. I am 100% bought into you and what you need. I'll sometimes tell my clients, I'm willing to walk to hell with you. If that's where we need to go, I don't want you going alone. So let's you and I go there together.
I love that. That's just so empathetic and like putting yourself in their shoes too and really being there for them. So that's great. So what would be like the first question, like a parent, if like a parent feels that maybe their child is going in that direction, like how do they break into that topic with them, like without seeming too overwhelming or overbearing, or what could be like the first question that you ask?
Yeah, well, so what's probably also already happening is there's some other red flags that parents are seeing around general mental health.
Hmm.
So it's typically clients or adolescents are not experiencing suicidal thoughts or suicidal behaviors out of the blue.
Hmm.
There's typically been an ongoing mental health issue. So usually some symptoms of depression, maybe anxiety. Was there a major trauma that just occurred? So we hope by the time this question comes up of are you safe, that we have a pattern or a history of talking about mental health together, and that's seen as um, a valid, reliable, safe, secure process that a parent and a child can go through together. And that's actually one of the reasons I tell parents, talk to your kids about their mental health, because you don't want this to be the first time you've ever talked to them.
Right. Yeah.
Right? You don't want to be like, hey, by the way, I heard this. And then it's like, whoa. Like, you want to be rehearsed and practiced. And so that's the first thing I always say is establish, regardless if your kid is sick or not, or where they are on the mental health continuum of health. We want to establish patterns that reinforce security and safety. And so that when you do need to have the conversations, the hard conversations, you already have that relationship and connection that's there.
Right. And the rapport is already there, and it's more of a not a surprise question.
Yeah. Yeah.
So okay, that makes
Um,
sense.
when that came up, I might start by saying, are you feeling safe today?
Hmm.
Okay, tell me how safe you're feeling. And a lot of times parents like, well, I don't want to be intrusive. I don't want to, push their boundaries. I don't want to push them away. And I always say, well, my experience, I don't know what the research says on this. My experience as a clinician, that if a parent doesn't respond overtly, sometimes the internal narrative of the adolescence is my parent doesn't care.
It's like a fine balance.
Yeah.
Yeah.
Because usually the way, especially if you're already prone to some suicidal ideation, maybe some depression, anxiety, most of the times those adolescents or young adults are not sitting there thinking, man, my parents are so respectful of my boundaries. They just love me so much. There would no one to not ask me about these things. They don't think through that. That's not the thought. If
Hmm.
you never ask about it, it's they don't care enough to ask. Or they're too afraid of what I might say. I am frightening my parents. Right there, we're miss a tune and we're gonna miss each other.
Yeah, that makes sense. What about what not to say as a
Yeah.
parent?
Equally as
Yeah.
important,
Yeah.
or maybe more so important.
Yeah.
So there's a few terms that I hear a lot, and I want to eradicate them from our nomenclature as a society. So a couple things that I might hear sometimes is, oh, they just want attention. Right? It's like, oh, you're chronically suicidal, so you must just want attention. And so then sometimes parents or even therapists will label that behavior as, they'll say, well, it's not really suicidal, it's parasuicidal or a suicidal gesture. Or does that make sense? They'll
Mm-hmm.
kind of couch it as like, oh, she just did it for attention. And that's really problematic.
Mm-hmm.
So let's not use the term suicidal gesture, parasuicidal. Let's not use any of those terms. What we need to get at, firstly, is saying this is suicidal self-injurious behavior or non-suicidal self-injurious behavior. That's why I started with that. Even the term, we've been talking a lot about suicide attempt. Some things that get really mixed into that is a lot of times I'll hear, well, it was a failed suicide attempt. And I will say, that's not a failure. That's a win. Like, failure's not good. Or sometimes I'll hear people talk about it was a successful suicide. And I don't want the word success and suicide in the same sentence.
Right.
Right. So that's some of the first parameters. We really, again, need to be clear about our language. This is self-directed harm. suicidal self-directed harm or non-suicidal. And what that does is it actually frees us up to see the child, to see what's actually going on. So as soon as we say, "Oh, it's just for attention," well, they don't really want to die, and we're just dismissive. Um, I always tell parents, like, well, think about that for a second. If I'm a child, I'm a 15-year-old scared to go to middle school, um, and the way for me to, if I did just want attention, the way for me, I have no other avenues of getting that emotional need met, that I have to scream from the rooftop, "Everyone, look at how much pain I'm in. Look at how distressed I'm in." That's a that's a pretty powerful statement.
Yeah.
It's perfectly natural and normal for a human to want love and care and attention. It's actually necessary.
Yeah.
So we can't just dismiss it in terms of, oh, they just want attention, because those are actual, real, valid means. It's an effective way to get that, and we can't just dismiss it. Does that make
Yeah,
sense?
totally. And, you hear oftentimes, after things have happened with kids is, oh, we did see some warning signs. Oh, wait, we did see cries for help. And I think they are dismissed. And that's kind of to your point of that people dismiss that without really taking it as seriously as maybe we should.
Yeah.
So,
Or it wasn't a genuine attempt.
mhm.
Because if you really wanted to, she would have done this. And like, okay, you're totally missing the point here. We need to get to what's this underlying need. Why is this child in so much pain and distress? But you ask, so if I'm a parent, how do I start to talk to my kid? If you're seeing a perpetual problem that keeps coming up, then you know that that's serving a function some way. There's something adaptive and actually something, as crazy as it sounds, um, stabilizing about that,
Hmm.
right? So a lot of times when we work with clients they've been having suicidal thoughts for 5 years, like, oh, ever since fifth grade, I've just always thought this, and then they do therapy and they get better and their depression really wanes and they find passions and their hobbies and they're excited about life, and then they're like, oh crap, for the first time in my life, I'm gonna be alive till I'm 20.
Hmm.
I've never thought that I would be alive till, but now that I am, and what do I want to do when I grow up, and who do I want to be, and how do I want to vote, and all of these things, all of a sudden they're having to confront all of those, and that's really hard and stressful, but staying in this place of suicidal thoughts and actions prevents all of that from ever taking place.
Mhm.
So in that kind of warped sense, it's actually a very stabilizing force in someone's life, if that makes any sense.
Yeah, no, it definitely makes sense. Yeah, definitely. So, okay. So you mentioned depression. And one question I have as a parent and just, the people that I know is like, do you have to have depression before you get to the point of suicidality, suicidal ideation?
Yeah, great question. So I don't know the statistics off the top of my head. The majority of those who experience suicidal thoughts and engage in suicidal um, self-injurious behavior likely do have some form of depression.
Mm.
However, that's not always the case. So there are some other issues that might come up that would lead to suicide. So I'm thinking other severe mental illness. So some type of psychosis or schizophrenia or something like that, where it's like this seemed fine, and all of a sudden this just comes up out of the blue. So that could be there. Sometimes we see it a lot with if there's been a trauma.
Mm.
It's like they were fine, something awful happens, and then ever since that moment, it just a switch flips, and all of a sudden they start to feel so disconnected from their body and maybe want or start thinking about suicide. It's a little bit of chicken or the egg, because you might say, well, doesn't that person also technically qualify as depressed as well? Maybe yes, maybe no. But you don't have to necessarily have this long, track record of months and months and months of being depressed that finally culminate in suicidal ideation. It can happen more quickly, although that's I think a little bit more rare.
Okay. Okay.
There's also people who are very impulsive. So again, maybe attached to some other mental health issues, bipolar or some other cognitive or executive functioning delay, where they seem pretty normal and they're actually happy and don't meet criteria for depression, but all of a sudden they get in an argument with a partner or something negative happens and they can be really impulsive and they can go to that dark place almost like a switch is flipped. Does that make sense?
Yeah.
So it's not always depression, but I would say most of the time
Okay.
that's what we're looking at.
Okay. All right. That makes sense. So, what are some of those you're mentioning these like warning signs and things like that that we should be looking for as parents and caregivers? And so, what's like the warning sign that you need to get help now? Like you need to reach out for crisis help when it comes to suicide.
Yeah. So my preference is that we intervene early.
Mhm.
We talk a lot about is, well, let's identify the risk factors and the protective factors. And in the theory is the more of the risk factors, the greater likelihood, and the more protective factors, the lower your likelihood. Um, so some things I brought some notes here just to make sure I get it all. So some common risk factors for individuals. So if you've made a prior attempt,
Mm.
okay, so your history of suicidal, self-directed violence, or self-injury. Um, Again, overall mental health. Um, if you have a history of mental health, substances. That's the other one I was gonna say. Sometimes suicide can be attached to a substance.
Got
That
it.
if had they not been on that substance, those ideations or behaviors wouldn't have happened. So, what's the substance use? What's that like? Is there How are they doing in their social role? So for adolescents, it's typically, are they going to school?
Hmm.
Are they successful at school? Are they not? So those are things. Um, how much access do they have to lethal means? Um, and then as a clinician, I always want to know what type of adverse childhood experiences have gone on. We talked, you hear on the podcast, we talk a lot about co-regulation
Hmm.
and our ability to co-regulate with a safe caregiver drives our ability to self-regulate throughout our life. And if we have these interruptions in early childhood or throughout childhood, our ability to self-regulate will be greatly diminished. And if you can't self-regulate, that might be a correlate with suicidal ideation.
Got it.
So those are some individual factors that we just know, risk factors that chronically can build up. So if those are present, and then I started to see a major change in behavior, I might think that maybe there's an increase in intensity
Hmm.
of the suicidal ideation or behavior. So all of a sudden they start giving away their possessions,
Hmm.
or they start to kind of give these pseudo goodbyes, or, well, I don't know, nothing really matters. That might give me pause. If there's an antecedent event, so an argument, a breakup, something like that,
Right.
that can really tip the scales. We also know if there's a family history of suicide,
Hmm.
and then high conflict, high stress, um, chaotic relationships where co-regulation can't happen. Those are all really big risk factors that I would want to look at.
Okay. That makes sense. As far as how to respond to my child when they are with empathy. I know we talked about empathy a lot in the last episode as well. So,
Yeah.
how do you respond with empathy to your child if they're having those suicidal thoughts?
One of the things as a therapist, if a client comes in to my office and it it seems like it's always as a therapist, I'm maybe I don't ever want to be caught off guard, obviously. So when a client comes in and they say, I've been having, here's the thoughts I've been having, and here's the actions I've taken, my first inclination is I always want to say something like, gosh, thank you so much for telling me.
Hmm.
I'm so glad. I hate that you're going through this. Oh, but I'm so glad to know it. It could have
Hmm.
been easy to not tell me, and I'm so glad that didn't happen.
Hmm.
What I noticed, so when I do that, so it does two things. One is it helps the client or the child be like, okay, there's some security here. I'm not going to overwhelm him.
Hmm.
Does that make sense?
Yeah.
He's not afraid of me now. He's like, oh, he's glad to know this. That's a little bit weird, but okay, I'm gonna see where this goes. So like, it kind of starts to instill like, okay, we got this. Oh, this is an issue we can handle. The thing that I like saying it for me is it reminds me, I got this. This is something we can handle, because
Yeah.
sometimes even therapists are not impervious to emotions and
Yeah.
to fear, and there's all these things, and that's something that no therapist wants to hear, but yet it's the thing that we most want to hear.
Right.
Like, if it's real for you, I want to know it.
Yeah.
Right? So if you're going through hell, I need to be there with you. So please include me in on this. So that's always the first, maybe not those exact words, but that first sense is like, "Ah, thank you for telling me.
Hmm.
What else can you tell me? Can I ask some questions?" And then I would start starting to tease that apart through our safety assessment and safety planning that we can do as trained professionals. If I was a parent, I would want to reinforce that same idea of thank you so much for telling me what else is real for you.
Mm-hmm.
How else can we talk?
Mm-hmm.
What else can you share? In general, if you're having that talk, I hope that your 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 family is already receiving some mental health services.
Mm-hmm.
If not, this is certainly the time to reach out and get those services accommodated for. In general, we kind of look at this hierarchy as we talk about. I'll go back to some terms if that's okay.
Yeah.
Because this is where
Yeah.
sometimes we get lost. So a lot of times parents will couch us in it's suicidality,
Mm-hmm.
and I really don't like that term suicidality because it's kind of
Okay.
this catch-all.
Yeah.
Like, I don't know, and don't make me even think about it. It's just something out there, and we'll just call it suicidality. I actually want to think about the specifics. Like the devil is in the details to some degree.
Yeah.
So I always separate it in, well, there's suicidal ideations and suicidal behaviors.
Okay.
And somewhere in there, there's suicidal urges.
Okay.
Okay, so a client can come and say, I have these thoughts. They keep coming to me.
Yeah.
I don't want to act on them. I haven't been acting on them. But here are the thoughts that I think. I think if I could just do X, Y, and Z, and that thought plays out in my head. So we kind of see how far we're on that continuum. Okay, so you have the thoughts, but you've not done any preparatory actions. You haven't thought about, I'll ask, have you thought about how you might play this out? Like, oh, no, I just think about what it would be like to not have to be in so much pain.
Right. Right.
So that's kind of one continuum. Then I would want to start asking, like, well, tell me about the urges. Do you have, if they're like, yes, here's my thoughts, here's how I would do it. Okay, have you had urges?
Mm.
Have you had impulses? Well, I almost did something yesterday, but I stopped myself. Like, okay, let's talk through that. And then the last kind of far end of the continuum is what we call suicidal behaviors. And these could include things like preparatory behaviors. So things that they may do in advance to put some affairs in order, or to collect or gather materials, whatever that might be. So as those are kind of how we think about risk. If you're on one end, if you're just having the thought, no urges, no behaviors, you're on the continuum.
Right.
But you're at this end.
Right.
The farther down you go, the higher the risk and the more immediate intervention that's necessary.
Right. And as a parent, you're like anywhere along that spectrum or that continuum is scary, and you want to get help right away. So I, as a parent being in that myself, sometimes it's hard for a parent to be like, okay, so you're just in the beginning of it. All right, we're okay, but you really have to take action still.
Yeah.
So
Yeah. And some things what I recommend, sometimes it's so I'll get asked like, well, do I need to take my daughter to the ER?
Yes.
What? So again, if my thought is if you have to ask,
Mhm.
the answer is probably yes.
Mhm.
But because what we don't want to do, I've seen parents. I'm against someone receiving intervention they don't need. It's so important that that we take it seriously, and how we respond as caregivers will directly impact how the child interprets the events. Does that make sense?
Yeah.
So I've had parents that are like, oh, we kind of just bumped along. We kind of just kept going business as usual.
Mhm.
Like, oh, thanks for telling me, but let's get your math homework done
Mm.
tonight, and we'll talk again tomorrow. And I was like, oh, it's not that bad. And things just keep going on. I've seen other parents that say, we didn't actually come to find out need to go to the ER, but having this kind of blow up made all of us look at it.
Mhm.
And we actually kind of needed for it to blow up because we were just in this rut of same old, and we needed something big and drastic to happen to our family
Yeah.
so that we could all wake up and take it more seriously and see where we are.
Right.
Most parents are not trained mental health professionals.
Right.
So it is always a little bit of a guessing game, and this is not something that you want to guess at.
Right.
So
Definitely.
if you're concerned and you're asking the question, you should take immediate action. So maybe this is a great time to identify help that you can have. So the new 988 number, super helpful. They can call and kind of walk the parent through, or even the adolescent through some steps and give us some clear direction. Parents should be aware of other local agencies.
Mhm.
So if I have a client or a child, if I'm the parent of a teen that's sometimes ends up on this continuum,
Mhm.
I would know what are my local resources? How do I connect to someone? Hopefully you're already working with a mental health professional.
Right.
We want to almost prepare for the worst and hope we never need that, but that's not the time to be like, man, we never confronted this reality.
Right.
We want to make sure we have a clear plan and know how the process works.
Definitely. And nowadays, there's even those mental health urgent cares that are popping up. They're
Yeah.
becoming more and more common. So at least it's a place you can go that's
Yeah.
a lot more accessible, which is nice. So I know there's some of those places that then, you then get continued care after that. But it's a great place to go if you're a parent and you're not sure what to do, but you hear these things and you need to take action right away.
Yep.
Yeah.
Absolutely.
So you mentioned family a lot. I've heard that
Yeah.
the family system a lot.
Yeah.
So tell me a little bit about why it's so important, especially in this situation, to have that family support system.
Yeah. Great question. So one of the things I'm always telling parents is, first of all, being a parent is hard.
Yes.
Hats off to every parent. I always want to be sensitive, but I sometimes, if I have I can kind of joke with them and say, I don't know whether or not your parenting is part of the problem.
Yeah.
It might be. Let's just acknowledge the fact that it might be.
Yeah.
It might not be, but let's just put that out there. However, I do know that your parenting is 100% a part of the solution.
Nice.
So one way or the other, you need to be involved.
Yeah.
Okay. And I've worked with, I don't know how many, dozens and dozens of clients who chronically had suicidal ideation, had a lot of suicidal actions. But it was always, is this actual genuine? Parents will always get in that. Is this real? Is this not real? And I always would say, well, how much harder does she have to shake you to say,
Right.
show up for me? So when we talk about families, again, I said this before, any perpetual problem is going to require a systemic solution. So if it's an issue that keeps coming up, that suicidal thinking or that suicidal actions has a role in the family system. Right? So there's something about that that's offering safety, sustainability. Maybe it's if I'm an adolescent and I'm in so much emotional pain and hurt, but no one's going to pay attention to that, but they'll pay attention to my physical pain and hurt. They'll respond. And what's great about that is I never have to be vulnerable. I never have to talk about our emotions. And the parents are like, yeah, we never have to talk about emotions. Let's just stick her in the hospital. So sometimes that plays out. Not all the time, but there is those dynamics. So most of our parents, as we were talking about, don't understand neurobiologically what's happening for their children.
Right.
As they say, well, she walks and talks like an adult. She's 16. I mean, she can drive her car. And it's a really tough conversation where we start to say, yes, and in these moments, emotionally, she maybe is more like a 6-year-old. And you're expecting her to be an adult, but really what she needs is this totally different approach. And how can you meet her nervous system's firing, totally dysregulated. We use this terminology of like flooded, disconnected. How can you, mom and dad, be there to be a co-regulatory force? Because she's needing, well, shouldn't she be able to co-regulate on her own? She's 16. Well, if she could, she would be. So she's showing us that she's not, so she needs parents. She needs the caregivers to come in and let's talk. And this will be new for your family, so let's come in and talk about how this can look for you all. Is that?
Yeah, I mean, no parent is perfect either, and we can't even co-regulate ourselves all the time, like we've talked about. So
yeah,
it's definitely a family system.
Yeah, and you bring up another great point, is that it's not possible for a dysregulated parent to provide a co-regulatory experience for their child. So at the same time, I cannot imagine something more dysregulating than your child experiencing suicidal thoughts or suicidal behaviors.
Exactly.
So the moment when your child needs you the most is probably when you're the least equipped to be there for them.
Right.
And so that's really why it's so important to get that family help and that family support.
And would you even go as far as to recommend for the parents to go and get mental health, counseling and therapy themselves?
Yeah, so my bias is that most of us could use a little bit more therapy in our lives, just in general. So as a blanket statement, yes. I can't diagnose via podcast for every single family. But yeah, absolutely. This is a great opportunity for the parents. Again, maybe you were part of the problem. Maybe you have been missing something and you have a hole in your own parenting style that's going to perpetuate unless you fix it. Or maybe not. Maybe you are the perfect parent, but maybe you do exist. Um, but going through this experience in and of itself can be painful and
Right.
traumatic enough that you'll need some help and support.
Yeah, that's what I was gonna say. It's just the experience itself can
Yeah.
make you want and need to get therapy yourself
Yeah.
to be able to just handle the stress and the emotions that come along with all of this. So
Yeah.
Yep.
It's also worth noting that I've never met a parent who wasn't also parented.
Right.
And so many of us parent our children however we were parented,
Right.
whether we want to or not, or in reaction. So again, yeah, I just love that family. Like, let's see what's let's see what's happening as a system
Mm-hmm.
as a whole, because we're all going to be a part of it, and it's going to require the whole family.
Yeah.
Even questions that sometimes, like, okay, so if my 15-year-old child is experiencing this, but I have this 11-year-old
Yeah.
child, like, they're seeing it. Are we
Yep.
not going to talk about it? How do you talk about suicide to an 11-year-old
Yeah.
or a 6-year? Like, they feel it and they know something's up.
Mhm.
So there's a lot of those family dynamics that even if they weren't a problem to begin with, they're gonna need some direct attention.
Yeah, I was gonna say that with families who have multiple siblings, in
Yeah.
the household, there's a lot of impact on the whole family in this situation. So even that younger or older sibling can really, need some counseling themselves
Yeah.
to help them through the whole family through this situation. So
Yep.
yeah, it's definitely important. So here's a question. So what if you go to your child to talk about the feelings that they're having and they push you away? Like they don't want to talk about it. Then what do you do?
Yeah. So totally. Maybe that's expected. Maybe it's not, but it's, I think, fairly common. Um, so what I always say as a parent, your job is to do what is developmentally appropriate for your child, independent of what that child's preferences are.
Mm.
Okay, and so sometimes when we're the most distressed, we're the most hurting, we're the least able to care for ourselves, is the times we most don't want anyone to help us.
Yeah.
Like, leave me alone. I need, so it's hard to be respectful, but what we always say, so we talk about this co-regulation. So a caregiver provides experiences of co-regulation, which from a child, I have very small children, so I think about this a lot.
Yeah.
As a child, we co-regulate together, and that builds the scaffolding for future self-regulation to take place on. Like, that's what actually builds the parts of the brain that's needed for self-regulation is co-regulation.
Yep.
Now, what's hard about this is when you are most dysregulated is when you are the least receptive to empathy.
Mm.
You're the least receptive to care. That's actually a great indicator that you're not regulated yourself. So I'll have talk with clients. They'll come into my office and they'll say, "Oh, my parents just need to leave me alone. I went in my room and I'm calming down. I just need to calm down on my own." And I would say, "Okay, that makes sense. But are you actually self-regulating, or are you becoming more dysregulated? Because if you are self-regulating, you will become more open to your parents' empathy."
Got it.
So if you go in your room for 30 minutes, and if you truly self-regulated, you would come out and be receptive to your parents. If you come out of the room and you're just as unreceptive as you were before,
Mhm.
I mean, there's some other relational dynamics of where the relationship, but
Yeah,
in
yeah.
general, if you cannot be receptive to empathy from a caregiver, whomever that is,
Mhm.
that's a sign that you're dysregulated.
You're dysregulated. Yeah.
And when that's happening, that's actually the caregiver's job. Like, I don't ask my 3-year-old in the middle of a tantrum what type of ice cream he wants at that moment, right?
Right.
I just say, like, you don't need, here's what you actually need. I'm going to parent you.
Mhm.
I'm going to give you what you need because you're a 3-year-old, and I don't expect, it would be wrong of me to expect for you to know exactly what you need in this moment.
Yeah. Really take control. You have
Yeah.
to take control of that situation. Yeah.
Yeah, exactly. So can be hard and that's why I say it's best if you've had a long ongoing history of talking about this. But if some families are like, we've never talked about emotions or how we feel, and all of a sudden my child ends up in the ER, and this is the first time I've ever asked my son how he feels inside
Right.
or how he feels about himself. I've never had that conversation. And so I'm like, well, I can understand him not opening up to you
Sure.
immediately
Yeah.
the first time.
Yep.
So we want to make sure we build those. But
Yeah.
sometimes parents get so, I want them to be happy and I don't want them to feel upset. And if I can just keep their emotions in check all the time.
Yeah, that's a tough job.
Yeah, you're never gonna be able to do that. You're never gonna be able it's not your job to keep them happy in this window, it's your job to prepare them for this.
That's right.
Because life's gonna give them everything, and it's your job to always meet them developmentally with what they need, independent of what their preference is.
Yeah, definitely. Yeah. Okay, great. Thanks for answering that. So I think we've covered almost everything on our list of topics. Jake, anything else that you want to share? You're such an expert in this area. Is there anything else that you've seen come up with your clients or parents that would be really important and helpful to share?
So I would say, can I share a couple of
Absolutely.
statistics? So a couple things to keep in mind. So 1 in 3 young adults between the ages of 18 and 25 experience mental, behavioral, or emotional health issues in the past year.
Hmm.
Suicide was the leading cause of death for 18 to 25-year-olds.
Wow.
It's historically been. And it's even stretching down into adolescence.
Hmm.
26.9% of teens ages 12 to 17 have one or more mental, emotional, developmental, behavioral problems. So almost 30% of all teens have some sort of emotional mental health problem. So these rates are going the wrong direction. So one of the things, if it's up to you to fix the suicide problem, you have unlimited funds and resources, how would you do it? The number one thing that I would do is for parents to stop giving their kids phones at such an early age.
Yeah.
So as we talked about, it's up to the parent to be developmentally attuned to what the child's ready for.
Yep.
And we can see the impacts of social media, particularly on our young women,
Oh, yeah.
compared to our young men, is very different. And most parents are wildly uneducated. They might have a general sense of like, oh, they're in their phones, haha. But they don't understand, or they underestimate the emotional impact
For sure.
that can have. So that's what I would recommend or just all parents to be aware of and watch out for, is the influence of 24/7 social media.
Yeah.
24/7. It's like self-judgment's open all the time.
Yep.
You can screw and see what everyone else is doing and see all the things that you're missing out on. You have there's just so much pressure that's baked into having to maintain that. So
Okay.
you don't get to come home and just turn off.
Right.
You come home and you have to turn back on. You got to be there and be present. There's just such a strong influence that it's really negatively impacting all of our mental
For
for
sure.
a variety of reasons.
I feel like that's a whole podcast topic in itself, about, cell phones and electronics and just the prevalence of that with kids.
Yeah.
Personally, being a parent, I've had to struggle with that as well and really set boundaries there. So it's a big topic for sure. Yeah.
Yeah. So we can jump into that
Yeah.
next time. But I think, again, for parents to be able and willing to go wherever they need to go
Yep.
to meet their kid. We also know that suicide is something that many adolescents struggle with thoughts, and not every thought turns into a behavior. And so it's important for parents to remember, my child told me this. That's an awesome thing.
Mm-hmm.
You should go to bed that night feeling great that your child disclosed this really scary, vulnerable thing to
Yeah.
you. You might also go to bed feeling awful that they're in that place,
Yeah.
but wouldn't you rather know it if
Mhm.
they're there?
Yep.
So,
Open communication.
yeah,
Yeah.
absolutely.
That's important for sure. Awesome. Well, thanks so much for your time
Yeah,
today.
great to be here.
Yeah, definitely. Definitely gave us some actionable items as parents on what to look out for, what to do, how to be more aware just of suicide in general. And so I think that was really helpful for me as a parent and hopefully for everybody else. Just wanted to thank you guys for joining us today. And also please make sure you subscribe to our Roadmap to Joy podcast and also follow us on all of our social media. Thanks so much, Jake. Appreciate you today.
Yep, thank you, Megan.